Hi, I'm Paula Moore, the chiropractor, presenting part 3 of Forward Head Posture, The Shocking Truth. Here we have an actual patient, only in their 60s, with some pretty devastating forward head carriage, and we're going to look at the health effects of this extreme forward head posture. So let me draw in a few lines to orient you again. First of all, we've got the chin, the base of the skull. So the head's in actual, the normal alignment, and this person's actually standing to have this x-ray taken, so pretty shocking. This is where their ear would be. This is where the shoulder would be. Now let me draw in a few lines. Vertebra number 1, 2, 3, 4, 5, 6, and 7. I'm going to draw in a line here. And I'm going to draw in another line to show you the measurement of how much forward head posture this person has. 87.4 millimeters. If I zoom in on that, see if we can see that a little more clearly. There we go. Okay, let me draw a few more lines here now, down the backs of the vertebra. If you go back to part 1, you'll see I also did this, and you're going to see that in part 1, the ideal head position meant the person's posture was very upright, almost in a vertical alignment. This person's is almost horizontal. Now again, if I zoom out, you can see this a little more clearly. There we go. Okay. Yes, so ideally we would have a C-shaped curve. You can see this person has an S shape, or what I call a reversed neck curve. Don't forget the spinal cord and arteries, so nerves and arteries lie underneath here, and there's a total kink, almost a 90-degree angle. Just imagine doing that to a garden hose, and the effects to the water flow. Well, here we're talking about blood flow and nerve function, so you can just guess the kinds of potential health effects this person could have. Now, ideally, the curve would begin at the base. It would have a C shape, and the ear would intersect the top of this line, but in actual fact the ear is sitting way out here. Now there's a law in physics known as Wolff's Law that tells us when a bone is under extreme loads or under changing loads, it has to adapt. We also know that for every inch that a head comes forward in this forward head posture, it takes an extra 50 to 30 pounds of muscle tension to keep the head upright. That's up to 2 stone. Now this is almost 4 inches forward, so that means that it takes an extra 4 to 8 stone, or 60 to 120 pounds of muscle effort to keep this head upright constantly. As a result, that's an awful lot of extra load on the bone, and the bone has started to remodel according to Wolff's Law, and that's a form of osteoarthritis. So if we look at the top vertebra, we see nice healthy disc spaces here, and then we get down to vertebra number 5, 6, 7, and you can see these bones have fused together. This is severe osteoarthritis, very little disc space left, and big, thick, flowing calcium deposits, bone spurs that have fused the bones together here. This person won't ever be able to bend their neck backwards again because of this fusion. So not only will they be experiencing discomfort and stiffness, but that will likely continue to progress. We'll do work obviously on the upper portion of the neck here, and trying to help just maintain the posture. But it would have been much better to see this person 30, 40 years ago. And as I said, they're only in their 60s, quite young. This is the very reason why one wants to correct forward head posture. This is extreme. Obviously, I don't see this every day, but this shows that this forward head posture does lead to osteoarthritis and other health problems. So I hope that's really useful. Go back to part 1 and 2 and take a look at the whole series. And please email me at posturevideos.com with any questions. Thanks for watching.